Good morning. I'm Kristine Fernandez, a senior staff dialysis nurse and certified nephrology nurse at Ilocos Training and Regional Medical Center. My research is entitled Infection Control Practices in the Hemodialysis Unit. Infection is the most common cause of admission among dialysis patients. It is due to the exposure of blood-borne infections such as the hepatitis B and hepatitis C virus. Another is bacterial infections that are present in contaminated water and frequently used equipment. A study of Singh states that contaminated healthcare worker hands are among the most common mode of transmission. Other are access-related infections, immunocompromised patients, and breaks in infection control recommended practices. Because of this, international organizations such as the CDC, KDOQI, and the KDIGO recommend guidelines on standard precautions, vascular access, water treatment, procedures of cleaning, disinfection, sterilization, waste management, and vaccination. However, there's still a challenge in bridging the gaps of infection control. In Vietnam, cleaning of dialyzer is not modern. There is also a problem in the maintenance of water system. In Thailand, water analysis was not properly done and monitored. In the Philippines, the Department of Health, under Administrative Order Number 2012 to ensure infection compliance. However, there's still an incidence of contaminated heparin that caused the chills of patients. Thus, this study investigates the knowledge and practice of healthcare workers on the hemodialysis unit regarding infection control practices. Healthcare workers must be of high caliber at the same time an advocate of infection control practices because they know well the consequences of acquiring an infection. However, through observation, healthcare workers become careless in adhering infection control practices because of lack in auditing tools and knowledge in infection control in the dialysis unit. For the methods, the researcher used descriptive research as the research describes the knowledge of procedures, measures, and practices in the implementation of the infection control procedures. Developmental because an output formulated was proposed based on the assessment of the variables of the study. For the participants of the study, healthcare workers working in the 5 private dialysis units in the province of La Union with the inclusion criteria of physician on duty, nurses of any position, renal technician of any job status. For the data gathering and procedures, researcher made questionnaire lifted from the DOH infection prevention and control assessment tool for hemodialysis was used with validity rating of 4.66 and reliability test of 0.82. Data gathering was from November 20, 2020 to December 8, 2020. For the data management, 5-point Likert scale were used in determining the level of knowledge and practice on infection control procedures among healthcare workers. An analysis of variance was elicited in the test of difference on the level of knowledge and practice on infection control between the 3 groups of respondents. The relationship between knowledge and practices on the infection control of the healthcare workers were computed using Person R at 0.05 level of significance. For the results and the discussions, healthcare workers are very highly knowledgeable on segregation, collection, and waste disposal. This implies that healthcare workers in the dialysis unit know on how the proper ways of waste disposal. Healthcare workers have a high cognition on the wearing of PPEs and ways on how to decontaminate, disinfect, and sterilize equipment. However, the use of plastic apron and other PPEs were not observed. Healthcare workers are well-versed on access care, However, there is a minimal failure in the identification on the signs and symptoms of infection. Healthcare workers are very highly knowledgeable on the importance of vaccination. However, a delay in updating staff vaccination was noted, resulting to the delayed administration on the succeeding doses. Water treatment is very highly knowledgeable. However, unfamiliarity to the test of chlorine and hardness tests were noted by the healthcare workers. Healthcare workers are practicing what they know regarding infection control. Healthcare workers always practice recycling and proper waste segregation. However, some dialysis centers has no touch and food-operated receptacles. Sharp container is not being disposed even though it is 3/4 full. Healthcare workers are always practicing access and catheter care for patients. However, proper identification of access or catheter care are not being identified properly. Dialysis centers use dialyzer as single-use and some reuse dialyzers that is still acceptable within the protocols as long as it will pass the recommended standards. PPEs are worn always. However, some hemodialysis workers, often practice hand hygiene and the 5 moments of hand hygiene. In addition, standalone dialysis clinics has limited supply of sink with soap and water and alcohol-based sanitizers that are placed at the frequently touched surfaces. For the water treatment tests are always practiced. However, respondents do not follow the proper steps on taking the water treatment test. Healthcare workers have been vaccinated with hepatitis B, influenza, pneumococcal, and COVID-19. However, there is a delay in administering the scheduled vaccination because of record keeping and monitoring lapses. For Table 2, nurses are equipped with knowledge on access and catheter care and appropriate antiseptic solution and antibiotics are used. However, there is a scarcity of physician on duty, especially on the freestanding dialysis unit. Another significant difference was on water treatment. Nurses knows the different ways of water treatment. However, renal technicians lack knowledge and trainings, and physician on duties doesn't have trainings and further understanding. On the level of practice, a significant difference on the healthcare workers' protection on TB screening and availability of vaccination as the identified culprits. For the relationship between knowledge and practice on infection control, this means that the one's knowledge on infection confidently explains one practice. However, there is still differences between the relationship between knowledge and practices on infection control. Healthcare workers may have a series of trainings and seminars. However, there may be a problem in the implementation and practice on infection control. Risk factors may be the guideline itself, how it is communicated, workplace culture, and willingness to apply. It is therefore the importance of the application of the acquired knowledge must be done through procedures and guidelines. Thus, the infection and danger is reduced and prevented. For the conclusion and recommendation, based on the research findings, the researcher concluded that the healthcare workers in the Union's dialysis center are highly knowledgeable on infection control. In light of this, highly acquired knowledge on infection control is very well practiced. The infection control program will ensure and sustain a safe working environment for both the patients and staff. Furthermore, studies along with this are recommended considering other areas not covered by the study. Thank you and God bless.